A wealthy, affluent, bustling city on the outskirts of downtown LA, Pasadena, known for its resources, premium healthcare access, and quality education. At first glance, it appears to be a place where health and opportunity are within reach for all. But beneath this image lies a more complex reality. Health and wellness here are not experienced equally. In Pasadena, health outcomes are not related to a lack of resources, but it's rather about who can truly access them.
I was born and raised in Pasadena. I love living here. I love the community here. I love everything that Pasadena has to offer.
It felt like very safe and nice, and probably wasn't until I got older and was in high school that I realized how sort of diverse Pasadena was.
I know every niche is different in Pasadena, so you'll have like a mixed bag. So that's why I really love practicing here.
I did think it was very interesting to see how all these everyone lived together, but we were all sort of in different parts of Pasadena, and it is in that way sort of it was split a bit.
This project has highlighted how social and economic factors continue to shape disparities in health outcomes even in affluent communities. Where someone lives, how much they earn, and the barriers they face can shape their ability to access care.
In terms of population, I've cared for a very diverse patient population here, widely with different, socioeconomic backgrounds. Some patients usually have like really excellent care to access to healthcare, and then others are having issues with transportation, financial burdens, or just medication costs.
You go down a couple blocks from where I lived, it was housing projects, and if you went a couple streets further, it was mansions. So you had like every sort of wealth level living in Pasadena.
Through our research, we learned the construction of the 210 freeway in the 1960s contributed to patterns of racial and economic separation. By cutting through parts of the cities, it displaced many residents, particularly in northwest Pasadena, and reshaped neighborhoods over time. These changes still influence differences in access to housing and healthcare across the community today.
The 210 that does exist right now, I think, definitely has created a substantial divide between certain income areas. The further away you live from the 210 was sort of the nicer the house would be.
I definitely think there can always be more resources. I'm never going to be that person that says like, yeah, we're good. We have enough resources.
Pasadena has some hospitals and providers nearby, but I wouldn't say it's super close. I still have to drive around 15 to 20 minutes to get to the nearest hospital.
I mean, when I was 26 and no longer on my own healthcare insurance, it became a lot harder for me to access healthcare. I really struggled with, just needing basic care.
I think what's been difficult to see and combat is just like, the healthcare system as a whole, right? So you're hearing a lot of things that are changing on a policy level that actually are affecting our patients. Pasadena, it's a lot of adolescents and geriatric. So I will say half my population is like 70 and above. So a lot of them are Medicare.
Thankfully, I was able to have Medicare. It's definitely been a different level of service of care than I've had before. But also, I'm discouraged from going in and trying to get extra medical help beyond a primary care doctor, because it's all like there's few places which I can be that accept Medicare.
Unfortunately, Medicare patients were no longer eligible to do telemed services, which really, really affected our population.
Despite the disparities and challenges some communities face in Pasadena, moments of crisis reveal a different side of the city.
There was a little bit of a setback, unfortunately, due to the Altadena fires that just affected our patient population widely.
The recent fires affected our community and me and my family a ton. It was a difficult time and it still affects us till this day. From the minute the fire started and how quickly it spread, and then the police coming to our homes and telling us that we have to evacuate immediately. We didn't know what to pack, we didn't know what to take with us, but we knew we had to get going.
Unfortunately, what I've been seeing is obviously an incline in mental health, so a lot of depression and anxiety and some PTSD, just because a lot of our patients were actually in the home or obviously lost their homes or, just had like a very symbolic meaning to the house in general.
And then eventually, when we had to come back to our home, we couldn't even live because the water was unsafe to drink or even shower with. The house was filled with ash, so it was not safe to breathe. It was very difficult. By the time we were able to live, it affected so many things. Even though this was one of the hardest things that Pasadena had to face, it was really beautiful to see how the community came together. From the first responders to the doctors to just volunteers, they were all ready to help.
The people affected by the wildfires are getting some much needed supplies today in Pasadena. Organizers, they focused on helping families with children, but anyone in need was welcome as well.
In the aftermath of the Eaton fire, neighbors came together, organizing food drives, sharing resources, and supporting those affected. Even more than a year later, that sense of community remained strong as residents continue to rebuild, supporting small businesses and helping one another get back on their feet.